Surgery to remove a ruptured appendix is very common, but a study out today found the price of such a common procedure can vary widely depending on the hospital. Dr. Jon LaPook tells us why.
Jamie Birdwell was still in college when she was rushed to the hospital with appendicitis.
We have really good insurance, and I thought everything would be pretty much covered.
But it wasn't. The hospital charged $13,000 for the one-day stay. Her insurance picked up most of the charges, but 2 years later, she's still paying off $1,100 of that bill.
So there were 3 different payments that we had to keep track of, which was pretty confusing.
It turns out Birdwell's bill was on the low side. Today's study looked at over 19,000 patients hospitalized in California for appendicitis without complications. There was a wide variation in cost, from $1,500 to nearly $183,000. The median, or middle ground, was about $33,000. The lead author of the study, Dr. Renee Shaw, says it adds up to complete confusion for the patient.
Hospitals can basically charge whatever they want because there's no guideline or reference pricing of how hospitals come up with what a charge is.
That's because hospitals create long, itemized bills for each service provided during the stay. This patient was charged $4,500 for CAT scans, $6,800 for anesthesia, and nearly $2,000 for IV solutions. The total? $53,728.
I study this, and I'm a physician, and I can't figure it out.
So how much should an appendectomy cost? Medicare's reimbursement rate is about $7,500. One consumer website, which gathers data from insurance claims, puts the cost at $8,000 to $10,000.
That's one of the main problems with our industry, is that there's no way to know what you get and how much it should cost.
If you go into a grocery store and a loaf of bread costs $5,000, you go across the street. But if you roll into an emergency room, you really have no choice, and that's why this whole problem is such a big deal.
John, it's amazing. Thank you very much.